Uh,
You're on mute.
Thank you for whoever told me that. I appreciate it. I will now start over. I appreciate that. Okay, hello, and welcome back to our yearly Back to School series for parents on Generation Z, sponsored by Jacob's Ladder Therapies. For those of you who are new to us, Jacob's Ladder Therapies specializes in individual and family therapy for teens, tweens, young adults, and parents suffering with anxiety, depression, mood and personality disorders, and family issues, including marital distress, communication problems, separation, divorce, life transitions, and addiction. Our services are finally back in person at our office in the San Jose, Los Gatos area, and are also delivered via telehealth video sessions. And newly, we offer walk and talk sessions in the North, South, and East Bay area. We have a diverse group of licensed clinicians and are able to deliver services in English, Spanish, and Mandarin. You can view all of our clinicians and their bios on our website, which I will post in the comment section. We are extremely passionate about providing free, informative sessions to the community at large. And today we have a special treat in being able to share one of our fabulous clinicians with you. Sunny Wang is a licensed marriage and family therapist with over 10 plus years of clinical experience working with children and adolescents and adults with a myriad of mood and personality disorders. She is especially trained in detecting and treating early psychosis and is a DBT-informed therapist, which is very rare. She is also a NAMI family support group facilitator and is bilingual in English and Mandarin. As a reminder, this session is strictly informative and should not take the place of therapeutic services delivered by a licensed professional. If you or your family member is experiencing a medical or psychiatric emergency, please call 911 or go to your nearest emergency room. If you feel you or your family member could benefit from therapeutic services, please contact us right away. We do provide free assessments to help determine the right level of care for your child, even if it's not with us. I will put the link to the self-schedule an assessment in the comment section. This evening, Sunny will talk to us about depression and anxiety. She plans to take us on a deeper dive into your teen's behavior, especially in the light of this pandemic. She will help you determine if your teen is depressed, anxious, or just being a moody teenager. Also, she will dispel the myths about self-harm and suicide. We are delighted to have an audience of parents and caregivers joining us via Zoom, Facebook, and YouTube. As this is your chance to ask an expert, please post your questions in the comment section and we will address them at the end of her presentation. If you miss any parts of this or want to recap, you can view it in the Jacob's Ladder Therapies Facebook page and YouTube channel. I will also post those links in the comment section as well. So without further ado, please welcome Sunny Wang.
Hi everyone, good evening. I'm so happy to be here. Thank you to Mitra for the wonderful introduction. I am a licensed marriage and family therapist working in the Bay Area for more than 10 years. In the last 7 years, I specialize working with teens. And I have some special training with early psychosis among teens. But recently I found my passion, which is working with teenagers who struggle with anxiety and depression, also with some of the very unfortunate behaviors such as suicide and self-harm. I want to remind the parents first and foremost that this could be a very sensitive and possibly painful subject. So I do want the parents to work on self-care because as the conversation goes on, it could bring out some very uncomfortable emotions. So I want to make sure that you are taking care of yourself first before you take care of somebody else. I also want to repeat what Tamitra just said earlier, that this is mostly for educational purpose. It is a summary of my clinical experience as perhaps some of the blind spots that the parents didn't notice. These are the information and the knowledge that I would probably demonstrate to most of the parents who are seeking support. As are you aware of these things are happening? I actually I completed like a PowerPoint slide for everyone, but I'm not really like a fan of reading it point by point. So I will have Tamitra to help me present the slides as you guys can read on your own. And I will kind of share with you some of the information that perhaps you don't really get to know unless you're in the therapy sessions with other people. So for example, so this is a front page. I think that Tamitra already kind of helped me to demonstrate the first 3 slides. So why don't we kind of just get to it to talk about the things that people do really care about, which is, are my teens struggling with mood disorders or on their way to mood disorders, and what exactly can I do to help? So today, there are a couple of things that I will cover. First of all, I will briefly introduce myself just to make sure that you are hearing something from a credible source. I will also explain my clinical background because the training that I have received is specifically for suicide and self-harm behaviors. And we are also going to talk about anxiety and depression, and we're going to talk about the causes and the treatments. We're also going to tackle the suicide and self-harm behaviors in terms of the myths, the risk factors, and what kind of the support that you can have. At the end, I would like to provide some helpful resources. I like to do the resources as something as personal educational purpose, all the way to crisis management. So you will get a little bit of support from every aspect. I hope it's helpful. And if you need anything else, again, you're more than welcome to send the link, the questions on the Zoom board, or you can contact Jacob's Ladder Therapy through our website, and we're more than welcome to do a personal consultation for you. All right, Mitra, let's go on to the next one. Okay, so here is what's going on for me. I was born in Taiwan, and I have been moving in California for more than 17 years. This allows me to provide bilingual and bicultural treatment for individuals, especially for Asian minorities or other minorities who are struggling with understanding exactly what mental health support is all about. I believe there are a lot of stigmas, and there are a lot of assumption of what treatment is really about. So earlier I mentioned that I have been volunteering at the NAMI Family Support Group as a group facilitator for parents who are struggling in terms of supporting their loved ones. Typically, my clinical approach is about DBT, which is dialectic behavioral therapy. DBT is founded by Marsha Linehan, which is one of the most famous psychologists that you can find in the history. She's female, she's still alive, and which makes DBT one of the newest school of thought. Marsha Linehan was actually a severely depressed individual when she was young. She was actually also known as a chronic cutter back in her teen days. And she was actually not responding well with the traditional treatment. So she decided to create a treatment for herself. And she dedicated her lifetime to amplify this treatment to save other individuals that are struggling with suicide and self-harm behaviors. This has actually been working because DBT has been widely recognized as the most effective treatment for individuals who are struggling with suicide and self-harm. And I also like the idea that DBT is not the traditional processing talk therapy, which is kind of like, you're in the room, you talk to your therapist, and you have this therapeutic relationship for years. DBT believes that you should be on your own, figuring out what you can do for yourself. It's a lot about self-efficacy. It's a lot about being accountable and feeling in control. So DBT thrives to teach the clients skill sets to help them to kind of pick up from where they're at, and being able to continue to foster that resiliency moving forward. And ultimately, the goal and the final objective for the DBT treatment is to help everyone to find life worth living. The idea of DBT stands for the two major concepts, which is acceptance and change. The idea is that at any given point, you're juggling between acceptance and change. Acceptance is from the Buddhist concept, which is life is always painful. You are always going to encounter things that are as miserable and suffering for you, such as COVID in the last 2 years. Something that you just don't see it coming, and you're just gonna have to learn ways to roll with it. And whenever you can, as long as you know how to tolerate the painful reality, we are moving on to change, which is, well, how can you make your life better under the circumstance that it's not doing so well? So DBT is a concept that at any given point, you're gonna find a sweet balance between acceptance and change. And that is pretty much the concept that we do when we're treating teens who are struggling with suicide and self-harm. So let's get into the concept of anxiety and depression. Thank you, Tamitra. Okay, so with the teen depression and anxiety, I'm sure if you go online, you can find a lot of clinical diagnosable criteria. I don't even need to get into the nitty-gritty educational phrase with you. I will be real with you about what are some of the things that we have seen when teen walks into our program and is wondering if they're struggling with anxiety and depression. So on the left side, you can see that this is a major depressive disorder. Couple of things to pay attention to. Number one, if your teen is struggling with irritability and constant mood swings, that is actually the #1 predictor that there's something wrong. A lot of time parents thought that depression means, oh, my kid is like the goth kid crying all the time, mood, just sadness. It's actually not true. The The most common symptom we see among teens who struggle with depression is actually irritability. And unfortunately, that gets misdiagnosed or mislabeled a lot with some of those terms like, oh, they have defiance disorder and they are having anger management problem. Or sometimes I hear extreme cases like, oh, I think my kid has bipolar because their mood is going up and down all the time. Well, first of all, I would like to clarify with the parents that you cannot diagnose anyone with bipolar disorder until they pass 18 years old. You can say that they possibly have bipolar traits, but it's definitely not a clinical diagnosable label that you can pin on the teens. Also, bipolar is quite a challenging diagnosis as you have to meet a lot of criteria and everybody's symptoms is very different. So one of the most common mistake that I hear among parents is, I think my child has defiant problem. And then as as we kind of continue to interview the teens, we realize that we're just really talking about depression. Another thing that we should look into is the change of sleep and diet. If we are looking into clinical diagnosable depression, there's definitely change of sleep and diet, whether it's sleeping more than usual or sleeping less than usual, eating more than usual or eating less than usual, okay? And then followed by the three musketeer of misery. This is my favorite, as almost every teen struggle with those three things: hopelessness, helplessness, and worthlessness. I call it the three musketeer for misery because with the three combination, you almost can't get out of that spiral of the blue, the sadness, that darkness that teens usually describe as their depression. Hopeless is an idea that I feel trapped. You can ask your teens about that. I use that all the time. Do you feel like you're trapped in your reality? Hopeless is an idea that there's nothing that I can do to make my reality different. So it's that sense of like, there's no way out, I'm trapped, I'm stuck. Helpless is, I don't think anybody gets me. So hopeless is more like about the environment. Helpless is more about the individual that they're interacting with. The school counselor doesn't understand me. My parents don't understand me. My friends can't even be there for me. And a lot of times with the hopeless and helplessness, when pairing up with worthlessness, which is a little bit more internal, as a sense of feeling shame, a sense of feeling not good enough. This is the idea that even if the reality can change, even if I do have people who care about me, I personally just don't feel like I deserve the help. So with the cutoff of the environment, with the cutoff of the support, and the cutoff of the self-motivation, you're probably going to get trapped in a place that is pretty dark. With all that, definitely you're going to have loss of interest and motivation. And I've heard parents say, oh, they're just being lazy. They're just being a lazy teenager. A lot of times I hear from the teens that I don't understand why my parents don't understand that it takes so much energy and so much effort to do something as simple as getting out of the bed. Something as little as get dressed and go to school. And a lot of times people can get so depressed and so exhausted from even just being around that brushing teeth is hard. Answering from someone who calls you from downstairs is hard. And the next thing is about inability to feel emotion. So this is a little bit tricky. We're talking about more of a severe depression at this point. If you have hopelessness, helplessness, worthlessness, you don't sleep well, you don't eat well, your mood is going back and forth and up and down all the time, you are pretty much in a malfunctioning place. And a lot of times when teens are in that kind of a constant emotional roller coaster, they would develop a self-protective mechanism, which is to shut everything off. They would create a sense of numbness as they just don't feel anything. It's almost like things got cut off completely. Sometimes when working with early psychosis teens with early psychosis symptoms, they also reported things kind of like, I feel like I am watching myself as from a movie. I'm not here. I'm completely disengaged from what's around me. And it's actually a very scary place because they feel like they're trapped in a bubble and nobody can notice them. And they are not able to engage with everyone around them, even though they're right next to them. This is the scary part because this is when the teens was started to use very extreme and aggressive behavior to feel alive. So this is when teens are considering suicide as, I just don't want to be here anymore. I don't want to live like this, or even using the self-harm to kind of snap out of that detachment. If you have teens who are struggling these symptoms for more than 2 weeks, I really believe that this is a good time to have a chance to talk to somebody else and someone professional, preferably. Now let's move on to the right side with the general anxiety disorder. General anxiety disorder, the first number one symptom you should pay attention to is poor concentration. This is the moment that teens would say, I don't know what you're talking about, I forgot, I don't remember. And then again, another popular term sometimes gets thrown out as, oh, I think my child has ADHD. Even the teens would say, I think I have ADHD, maybe I should get prescribed with medication. ADHD, again, takes a lot of diagnosing criteria in order to call it ADHD. And a lot of times, we simply look into that poor concentration as, oh, this person just had processing problem. And I think it's because societal speaking, ADHD is more culturally acceptable than anxiety. So in a way, it's easier to accept my child has ADHD instead of accepting the reality that my child has anxiety. Now, ADHD does get prescribed with stimulant, and a lot of times stimulant doesn't work with the anxiety. In fact, it could make it worse. So this is also a lot of times that I have family come into our treatment say that I have ADHD and I got prescribed, but it didn't work out. In fact, I got worse. A lot of the times it's because we rather to go into the ADHD route instead of to consider the fact that maybe there's something wrong and closer to the anxiety route. When there's an anxiety disorder, one of the things that you can pay attention is the physical discomfort. If the teens have anxiety, chances are you would notice a lot of physical stuff such as headaches, chest pain, back pains, or even grinding teeth, or stomach aches, feeling sore and tired a lot. You would notice a lot of that. And usually it's a sign that teens feel like it's a little bit easier to talk about their physical complaints rather than their emotional complaints. This also happens a lot among minorities, as myself, who's from Taiwan. A lot of people would just say, oh, I just have this chronic headaches. But the more we dive in, we realize that headache comes out when you're stressed out, or I have back pains, or I grind my teeth at night. Those are all signs of anxiety. Easily overwhelmed is because there are two major belief systems among people who struggle with anxiety. Number one, the world is such a scary place. So you project the world as a place as the worst outcome ever. And the second belief is that there's nothing that I can do. So you have an over projection of how scary the world is, and you completely minimize your ability to take care of things. With that two, almost like one is too far and one is too weak, you create a very scary discrepancy as this is the place where this is the world that you're just going with the flow and you have no control, and all you're hitting is the worst outcome. So with that two belief system intertwined, you're easily overwhelmed, which is understandable. Also, you would notice that there's some restlessness, as nail biting or leg shaking, sometimes could be fidgets. People can go into extreme as plucking hair or plucking eyebrows, or even they would develop some OCD signs as they're checking their, washing their hands very frequently, or checking doors, or feeling paranoid that people are following them, or they're being watched on the internet, things like that. A lot of time you could also get rumination, inability to problem solve, which is you just don't know what to do. I mean, that goes back to the easily overwhelmed situation as I don't know how to handle the world's worst scenario, and I don't know how to figure it out on my own. all that definitely would kind of roll into loss of energy. And if that has been more than 6 months, then we're looking at something pretty severe as anxiety disorders. Now, you might notice that there are a couple of things that are highlighted in this slides. Those are the highlights that I was getting some resources as these are the top 5 mutual symptoms between anxiety and depression. It means that if your teen struggles with mood swings, poor concentration, change of sleep, restlessness, and inability to feel emotions, we're looking at a combination of depression and anxiety. So hopefully that will help you guys to kind of figure out how do I have a better navigation of, what to do for my teens. Thank you, Tamitra. All right, so here it goes to the causes and the available treatment. So in general, the world of psychology has different interpretation of why people are not well. In general, and let's say for the medical part, there's definitely a group like mostly MDs, psychiatrists, and scientists that believe that this is all biological, chemical imbalance, hormonal changes, or even possible brain injuries that kind of change the structure of your brain. So it's very organic in a way, like the nature versus nurture. And we're talking about the nature piece, as there's something that is organically happening in your body that trigger or cause the inability to feel pleasure. With the biological causes, most of them, the counteracting treatment will be about medication and supplements, or even surgeries and things like that. I want to be very careful with the idea of only putting your child on medication, because medication is an idea of altering the brain chemistry and making sure that they're floating in the right balance. And teens are going through puberty. It means that their brain is still growing. So if you want to put your teens through medical treatment, such as medication, I am not opposing that, because it's definitely much better than no treatment at all. However, when it comes to medication, you have to make sure that you have a good relationship with a psychiatrist who know what they're doing, and then be able to pay attention to any side effects, and also understanding that medication takes weeks. We're talking about 3 to 6 weeks to actually see the effect. So if you're on and off with medication because it's kind of like, oh, Tylenol, I don't feel so well, so I pop the medication and hopefully it will get better, it's not going to work out. We're also talking about teens who have a hard time to constantly want to be on meds. So the best outcome, if you want to consider medication, is to find someone who has been specially trained with child psychiatry and try to find treatment along the medication management to make sure that we're not just about altering the brain chemicals, we're also supporting the teens to find good ways and behavioral ways to help themselves get out of the misery. And I will talk a little bit more later about another disadvantage of putting your teens on medication solely. Another, the Marsha Linehan, the founder of DBT, as a depressed teen, she was under a lot of care for cognitive behavioral therapy, which is one of the most old school thoughts that your thought process, your belief system shapes your behavior. I feel like the world is a scary place, so I avoid everything. So your belief system alters your behavior. This is the time that we talk about CBT therapy. I'm sure a lot of you have heard of it. It's an idea of challenging the belief system in order to modify the behaviors. A lot of time, cognitive behavioral therapy is tricky because some people really respond well with that. Some people believe that even if I change what I believe, I'm still miserable, okay? And a lot of times I will also say that anxiety, depression could be a learned behavior. So this is what happened in the program that I'm working with. So I'm working in the hospital program and intensive outpatient care. Most of my teens will come into this program and describe a culture that they have to behave certain ways in order to get validation and attention from their loved ones. So We call it this as you latch onto an identity that you have to be a depressed or anxious person, because if you don't, people don't take you seriously. And sometimes what's really scary is that even when the teens get better, let's say organically or even thought process wise, like they know that they're not thinking right, the culture itself as labeling the person as a depressed person could still be could still be a factor that that I want to maintain and the identity as a depressed person, because if I don't know who I am anymore. So that's one of the things that we notice a lot among teens, is that being depressed is kind of like a trendy thing. And if you don't behave certain ways, you might lose your spot among your friends. Now, I think, Dimitra, we're moving on to the last, next slide. Can we go back to the last one? And so I think the next one is really about the trauma, which is when people are going through traumatic experience, such as a terrible childhood, parent divorce, moving from one place to another, perhaps going through COVID could be a trauma, accidents or early exposure to substances. Those are all possible situations that could trigger a teen to develop anxiety and anxiety or depression. When it comes to trauma treatment, one of the things is like we tend to do processing therapy, which is you kind of talk about what happened, because when you hit with the trauma, a lot of time people learn to shove it down. People learn to not look into the triggers and or the things that bothers them, and that the gesture of repressing your feelings or repressing your flashbacks could create the numbness that we're talking about. As I try so hard to not feel anything, I actually stop feeling something, and then I can't get it back. I don't know how to feel things anymore. So process therapy is a way of untangling those suppressed and hidden emotions and possible the events or a belief system that has been told that it's not appropriate to experience. EMDR, which stands for eye movement desensitization and reprocessing therapy, is a very special types of treatment that specialize in trauma. It's an idea that by having rapid eye movement, they are able to tease out something that has been suppressed for so long. Or if you have someone who got early exposure to substances, 12-step would be a really good help, because it talks a lot about how did the substances impact your life, and how do you make the environment more supportive for you. The final one is my favorite, which is the combination of nature and nurture. So this is an idea that it's not just about nature or nurture, it's both. In fact, it's not both. It's about the relationship between the nature and the nurture. Transactional theory means that teens from 10 to 25, they're experiencing something called emotional vulnerability. This is the 15 years that makes them extremely emotionally vulnerable, as they don't know how to manage their emotion more effectively, because they feel the emotion much more and much longer and less likely to de-escalate in those times. This is kind of why we say, oh, my teens are just feel so much that they're extremely happy, extremely angry, extremely sad. Well, that's because they do have that emotional vulnerability as teenagers. And when you have a teen who has emotional vulnerability, pairing up with invalidating environment, which is the school, the family, the friends, or even the culture that talks about as you don't have to feel that way, right? Or you can just snap out of depression, right? That sounds terrible, but what happened to your homework? Those are all kind of like the few example of what invalidating environment would look like, which is not understanding or listening what the child is going through. When you have emotional vulnerability and you add on to invalidating environment, this is when the teen feels like I'm never going to get out of this thing. And they also would develop the idea that I need to amplify and get more and more emotional so that my friends can hear me out, so that my parents can understand me. And this is kind of like the slippery slope into suicide and self-harm behavior. And this is why transactional theory works the best with DBT-informed treatment, because DBT-informed treatment is about self-validation. It's about being able to find your own inner strength and to be resilient. So the skill set talks about ways to self-validate. The skill set helps the team's loved ones to learn how to properly validate. And then if we're not doing the transactional zigzagging and validating pattern, then things will blossom on its own. Thank you, Tamitra. We're moving to the next one. Okay, so let's talk about suicide, because I'm sure that this is what we're all curious about. First thing I want to know is that suicide is the leading cause for the teen's death. I believe it's either number 2 or number 3, right next to accidents. So suicide is definitely something that happens a lot among teens. And the place that I work at, which is in the Silicon Valley area, we're looking into a very competitive culture. We're talking about parents are being the elite of their community. They're the best of the best. They're the CEO of the startup company. They are the principals or the professor of the Stanford, things like that. When we have elite parents, we have very stressed teens. It's really hard to achieve what their parents have achieved. The parents give a lot of expectation of all the things that they should be good at. So definitely Silicon Valley, specifically Palo Alto area, has been known as one of the area that has the highest suicide rate among teens. In fact, some of the high schools are having pretty much like yearly, people would take their lives, and they're trying really hard to not make it happen. And with the COVID that's been happening lately, definitely we're seeing a large increase of family looking for treatment because their teens are falling off the wagon as things are just not doing well since 2020. So suicide is definitely a huge subject. Now let's talk about the myth about teen suicide. The first thing is about, if we talk about suicide, maybe this will insert an idea to their head. The reality is it's already in their head. And we're in this era that people can get a hold of a lot of information, more than you can ever imagine. If you feel like not talking about it is going to make them from not doing it, it's not going to work. It's kind of like the same thing about sexual activities. Just because you don't talk about it doesn't mean you're not going to explore that. In fact, the more effective approach would be to actually have an open conversation about suicide and then understand where they're coming from. You'll be surprised the culture that they're learning, because if you don't talk about it, somebody else is going to talk to them about it, and you would not have any control of what kind of idea they're putting in your child's head. So you have to have a conversation with your teens about suicide. Blocking them from that concept isn't going to work. Next thing is that the teen talk about suicide won't really do it. Well, that is definitely one of the top invalidating statements that you can say to teens if someone tells you that I feel like I want to kill myself. So if you say like you're just saying that because you're not doing well in school, you're just saying that because you want to play more video games, well, that could spike up some helplessness and hopelessness. And that could even spike up some, watch what I can do kind of, just out of spite. If the teen has emotional vulnerability, which is they're already going through mood swings, this might just be the last push for them to go into something really extreme. And a lot of times I also want to clear that when I interview teens who struggle with suicidality, which there are a lot, most of the teens, almost all of them, don't really want to be dead. What they want is a feeling if they're dead, which is they're free from all the pressure that are put onto them. They want to be in a place where they don't have to feel what they're feeling right now. So, and a lot of times, because they don't really know what to do, it's not like they're like us that we can just take a day off and go on vacation or have a free shopping spree, or to do whatever they want, like as an adult, because their resources are pretty limited. A lot of times they feel like, how do I get out of this trap feeling? And a lot of times death becomes the only option, as like, I feel like I need to be dead in order to avoid and escape from this painful reality. So a lot of time, pay attention that suicide is not really about being dead. It's a lot about wanting to escape. And if you can have that conversation, you will be surprised how much you didn't pay attention to. So the next one is about attention-seeking behavior. I can definitely see that. I do want to validate that we do have a lot of teens who threaten to kill themselves or hurt themselves for the sake of attention-seeking. And yes, it can be exhausting. And yes, a lot of times you just want to call them out as, you're just saying that because you don't like what I just told you. And at the same time, sometimes it could be a cry for help. You just never know. And a lot of times, one of the dilemma that we encounter with the parents is that we take every statement related to suicide very seriously. This is also good practice to let your teen knows that we're not taking this lightly. This is not a bluff kind of a situation. If you're going to bring that word out, it means that we're going to take care of it. It's a sign of care. It's a sign of respect. It's a sign that we want to figure things out together. So a lot of times teen would say, I don't want to live anymore. I don't want to be here anymore. And then we say, hey, then maybe we need to, check into an emergency room and figure things out. We will get a lot of parents and say, oh, they talk about that all the time. They'll be fine. You cannot take that chance. I mean, it takes one chance for you to realize that you lost something so significant in your life, right? So the idea is that the suicide is never just about yes or no, like one day I feel suicidal, next day I don't. Suicidality probably has been brewing for a while, from something as light as, I wish I'm not here. I wish I can, go to sleep and never wake up. I wish something bad happened to me. Like if there's a fire in this building, I'm glad I didn't make it out. Those are passive suicidality, as I don't want to end my own life, but I won't fight it when something happened to me. Moving on to active ideation, this is what we're talking about. Like you want to be dead and you know how to do it. And that is also another, sign of, that's also another sign of like a development as, if you want to be dead, are there, people start kind of doing research about, what could kill me painlessly? How can I get those things? What are the dosages that I can take in order for me to stop breathing? That kind of stuff. And then moving on to something that's more concrete, that's like, I know when to do it. I know where to do it. And I know how to do it, and I am ready to say goodbye to people. So it's a slippery slope and a developmental kind of a spectrum that you will go from something as light as, oh, life is so hard, to I won't see you tomorrow. All right. And then now another thing that people talk about is like, oh, even if we, you can never stop them. You just don't know, because they could just decide to take their lives. Well, suicide is definitely preventable. The research have shown that by adding as many roadblocks and walls and wires around the Golden Gate Bridge, the suicide rate actually reduced down to up to 30%. And a lot of times suicide for teens is a sense of like a craving, an impulsive decision. Craving lasts about like 15 minutes. Impulse probably lasts about half an hour at most. If the teens cannot access anything in that 15 minutes or in that half an hour, as I just really want to do something, then when the craving pass, when the urges pass, people usually would feel like okay. And so the idea is that out of sight, out of mind, especially for firearms. I don't know if we have any parents here who do have guns at home. If we're talking about the one thing that you should remove if you feel your teen, if your teen is struggling with suicide anxiety, you should put the guns away, because guns actually have the highest success rate for suicide. So someone can have overdose and most of the medication aren't deadly. It would just be very uncomfortable, or you have to be in a hospital and get your stomach pumped. Having an access to a firearm is that one option that you cannot take it back. So I will highly encourage the parents that I understand that you have the duty as a householder to kind of protect your house. You believe that, we are entitled to have weapons. I totally feel you. I feel the same way. And at the same time, you are having one of the scariest items for your teens to hold on to. And once they have that moment and they have that tool, you cannot get it back, okay? Last one, which is the thing I really want to talk about, and that is getting better means that suicide is off the table. So in the earlier slides, I talk about that if you have your child on medication, be very careful that on medications only is a very high risk. Now, I am pretty sure a lot of you have seen commercials that talks about antidepressants also have the side effects of increasing suicide rate. And you must be wondering, well, that's counterintuitive because why would I want to take any antidepressants that would make me more suicidal? So here's the reality. What happened is that medication, which is the chemicals that alternate your brain chemistry to bring your mood and bring your energy level to a more of an optimal place. So you instantly feel better. You feel like you have more motivation, you have energy level, you're more concentrated, those kind of things. So you get a little boost of like energy stuff. And a lot of times without proper treatment, without having a professional that is guiding the person or even showing the person how to build resiliency to cope with their depression, that boost of energy, that boost of motivation and like the concentration could be misdirected to complete their suicide plan. So it's not that the medication itself creates more suicide. It's an idea that if you only rely on medication, then the medication in terms of what it elevates in your head is, I feel better. The person will actually feel like I finally feel better enough to finish what I haven't done. Because a lot of times people will say, I didn't commit suicide because I'm too tired to do it. I'm too exhausted to do that. I feel too sloppy to even walk out of the house. So that plan didn't work out. But if you have medication that just bring your energy level up a lot, some of them could use that energy and to finish it off by leaving the house, by purchasing that medication, by driving around because they finally have the energy to do what they couldn't do when they're very depressed. So I want to be very careful that I want you to be very careful about getting better. It doesn't mean that suicide is off the table. I also want to clear that the history of attempt is the highest, the biggest predictor because the person already been there, done it in a way as this time I'm going to do it right. This time around, they will find a better way to not get caught. They will find a better way to really make it work. It's kind of like if you have practice, then that makes perfection in a way, which is a very scary thought as for suicide, but that does happen. So I definitely want individuals to kind of like be more mindful of that, and feel free to leave any comments or feedback if you can, and I'm more than happy to answer that. Tamisha, can we go to the next slide? Okay, so when it comes to self-harm, I want to address that self-harm is the major 4 ways of self-harm, 4 reasons to self-harm. One thing is to feel better because self-harm does spike up happy hormone in your head, which gives you a sense of gratification. So self-harm is an addiction. People do get cravings and you do have to self-harm more to get that sense of satisfaction. Another time is that people self-harm because they want to punish themselves because this is a perfectionistic coming as I don't feel good enough, I feel worthless, I'm embarrassed of myself. They need to punish themselves in order to feel like they can move on another day. Sometimes when people are struggling with severe emotional pain, such as trauma, abuse, and they're going through numbness, they just want the physical pain to distract them, or at least to feel like they're still alive. In order to help teens who struggle with self-harm, you have to know why they self-harm at the first place. So on the right side, you see some effective solution based on the 4 reasons. If your teen is struggling with self-harm because of their perfectionistic tendency, then we're tackling the belief system. If they're struggling with numbness, then we need to find ways to cope with the numbness and be able to express their emotions in a safer way. If it's really about that, I don't know how to get out of it because I've been cutting for so long, and I crave it, then we have another set of DVT skills that can help you. But for the sake of time, I want to just kind of be brief and just introduce the self-harm concept. Once you know the reason, you should keep it to your head instead of labeling your teens. Have an open-ended conversation with your teen to find out what is going on and what is the purpose of the self-harm. Once you know the root cause or the real reason, you can foster solutions accordingly, and that will bring you to more of an effective place. Demetra, we can go to the next one. All right, so as we're moving on to the end piece of the slides, I just want to talk about the risk factors for suicide and self-harm. On the left side, you will see individual factors. So this is more like kind of like predisposition, pre-existing condition. Definitely number 1 is the history of attempts. We usually say that once the teen tries self-harm, the door is open because the brain already registered what it feels like to feel the pain. And definitely for suicide, once the person has built up the courage and the dedication to actually try something as a suicide attempt, they already kind of like passed that hill, and it's really, and that will be the biggest risk factor for you, to realize that this might stay with their system for a while. If your teens are struggling with long-term illness, such as like OCD or psychosis or cardiovascular disease, things like that, you can then that's another predictor that teens would say, I just don't want to live like this. I wish I can have a do-over kind of a way. LGBTQA is definitely a community that struggles a lot with suicide and self-harm. At least 40% of the LGBTQA youth have seriously considered suicide. And I think this really comes from the sense of not feeling accepted by their culture and by the society. Teens don't feel comfortable sharing and be comfortable with their own sexuality or their own gender identity. And that creates a sense of like, what's wrong with me? I don't belong here. Nobody loves me for who I am. Then we're kind of looking into the worthlessness. So definitely it's not there's something wrong with them. I think it's really more about the lack of understanding of this population that creates a lot more suicide and self-harm risk. Next one is we're talking about firearms. If you have something like that, then or sharps or medication hanging around, then definitely we're looking at higher chances of actually having those attempts because it's so easy. It's right there. If no one's at home, maybe I'll give it a shot. So that's usually sometimes what we found out as like, oh, we didn't know that they've been plotting this. So if you feel like we should just put things away, I would highly suggest that just do it. We usually would recommend the parents to lock the sharps, to lock up the medications, or to have conversations about, or make sure that you guys manage the medication for the teens. Relationship factors, things around the environment, definitely exposure to sexual, physical abuse, loss of significant relationships such as parents' divorce, moving out of the country, COVID, I don't get to see my friends anymore. If there's a family history of suicide, that's also kind of like a normalization process, as like someone else in my family has done it before, why can't I do it anyway? Cultural influences, we do have teens who thrive and influence on If you act suicidal, if you talk about self-harm, you do get more attention. And then teens kind of thrive from that. It's like, oh, I have to present certain ways in order for my friends to pay attention to me. Lack of support from your loved ones and isolation. So those are all predictors and risk factors. Not saying that if they have it, if these things are there, it definitely would trigger suicide and self-harm. Just kind of like some warning signs for you to pay attention to. And definitely more risk factors, higher the chances. All right. We're moving on to the next one, Mitra. All right, so here are some warning signs and effective support. Moodiness, change of sleep and self-care, withdrawn. If you find that your teens are researching something, I'm sure you can find out about their search history. If you see something sketchy, that's probably an indication. If you are being asked to hold on to a note and not open it, that is very scary. Definitely take that as a warning signs. And if they have constantly talk about that, they feel trapped, they're miserable, they don't feel like they can make it out, those are all possible red flags for you. Effective support, I think this is really important. First thing you want to pay attention is not have your own judgment. I think suicide and self-harm is a very scary thing to talk about. Sometimes people find comfort to label or oversimplify or to just ignore as, do we really have to talk about that? Do you really feel like this is an issue? Avoidance doesn't make it go away. So if you, or sometimes people say, oh yeah, well, you're just being dramatic. You know, that's a judgment. Judgment and oversimplification, oh, you're just going through a phase, or withdrawal as like, I don't feel comfortable talking about it. That would definitely trigger that. So undo those things, you might have a better conversation. Definitely try to use open-ended question because you're here not to find out yes or no. They're not going to give you a straight answer. What you're trying to find out is what's going on. And finding out the risk factor, finding out the vulnerability factors, find out what they have learned about suicide. And also this shows that you're paying attention and you're listening. Because one of the things that you can do, and the easiest thing probably that you can do, is to be an active listener. Actually have a space and have a talk with your teens about what's been going on. That will automatically reduce their risk of suicide and self-harm because they don't want to do that. They're doing that as a way to escape from the reality. However, if they do have an outlet to be able to talk about what's happening, they don't want to do that. No one enjoys self-harm and suicide. They often feel like they're a burden because they have so much going on. However, if they're being validated as you're not too much, you're just someone who's struggling and I'm here for you, that will automatically reduce the chance of the risk. The last one I really want to talk about, which is the protective factors. Teens have things to live for. We always ask them, if we can make these misery go away, would you still want to live? And they will say, oh, of course, I will want to live. I love my friends. I love my parents. I love my dog. I long to travel around the world. I have a lot of things that I haven't done. Well, enhance those protective factors as the things that makes them feel alive. Let them understand that if there is a suicide, it will be devastating for you. Let them understand that the family needs them. Let them understand that this is a very scary thing for you as well. Your ability to show vulnerability is a very good strategies to make sure that your team can do the same with you. I think we're in the last slide. The final slide, Dimitra. All right, here are some available resources. For the helpful media, I have tried some TV shows, movies, the book, and the podcast. 2021, there's a new movie called Joe Bell. Very good movie. I think that it captured the dynamic between the teens and the parents and the struggles that they encounter. I think this is a very good movie for family to watch. The Life We're Living is Marsha Lynn and Han's story. Talked about that she was a depressed teen and her relationship with her mother. Savvy Psychologist is a pretty fun and short and scientist evidence-based podcast that talks about little things that you should know. They're a different subject and it is not strictly to the teens and the parents, but definitely I found something really helpful and resourceful. On Children is a Taiwanese drama that's on Netflix. It talks about the professionistic elite parents and how that stressed the teens out. It is, although a show based in the Taiwan culture, but when I was watching it, it reflects a lot as a Silicon Valley kids lifestyle. When it comes to the helpline, here's some numbers for you. We even have texting here. If you want to find the right therapist to talk to or to consult, Psychology Today is a good resource. It's kind of like a search engine for mental health resources. I also want to share NAMI. NAMI is National Alliance of Mental Illness. It's across the entire country. So just type in the county that you have, and then they will kind of like show you the resources. Last one's the crisis management. If it comes to a point that we just really need some immediate support, you can contact the crisis mobile team, or you can ask the local police to send somebody with the crisis intervention team training. I think we're all set. Thank you guys for all the attention. Maybe there's some questions that I can answer, or maybe we're running out of time.
No, we definitely have some questions, Sunny. Thank you so much for that presentation. I have a few questions. First, could I make my teen better without therapy?
Well, that is a hopeful question, and I would love to say yes. And my guess is that parents cannot be parents cannot be the doctor and the school counselor and the therapist and maybe a coach. You have too many hats to wear, and at the end of the day, you are the parent. A lot of times, perhaps you're the problem, and your team cannot tell you that they have issues with you when you're trying to help. So a lot of times I would suggest to find someone professional to talk to, or at least to have an open-ended conversation to figure out what's going on first. But try not to hold on to the idea that I need to solve everything for my child, because a lot of time that doesn't really work.
Okay, thank you. There was another question. Should I monitor my kids' friends and social media to prevent depression?
Yes. I think that given the culture that we've been hit, I think it's a good idea to monitor, but not as a way as catch me if you can, like a spy kind of a thing. Kids are really smart. They know what you're doing. And if they haven't figured it out, they eventually will. If they realize that you're secretly reading their text messages, or you have a track history or whatnot, you're going to push them away. And they're going to find more discreet ways to deal with their problem, to talk to their friends without you knowing it. And at that point, they know that you're not a reliable or supportive figure. You are kind of like a spy, and the trust is gone. So you definitely don't want to put yourself in that position as, oh, my parents are sneaky. That would definitely cut the bridge of positive communication.
Mm-hmm. And I also want to add that session 3 that's coming up on September 15th, we're going to talk about the ABCs of social media. So you'll get more information on the sites that the teens are using, and the different ways that they can actually hide what they're doing from you on your phone. So we will talk about that. I have another question that just popped up. Can you give me an example of an open-ended conversation to bring up with my team?
Good question. Open-ended conversation in general is try to limit a yes or no kind of an answer. So instead of like, did you have a good day? That's a close-ended question, because you are only allowing your child to answer either good or bad. So instead of, did you have a good day at school? You can ask, how was your day at school? So the word how brings out different aspects and different venues and different approach for them to talk to you about how their day has been going in their school. Another open-ended question could be, what are your thoughts about suicide? Instead of saying, have you thought about killing yourself? Because if you're asking, have you thought about self-harm? you're again limiting into just yes or no. However, if you use the words as like, what's your take on for self-harm among your teen, like among the school, like, or like, what is the culture like nowadays about teen suicide? You're being more of a curious instead of a demanding person to find out what's been going on. In a way, open-ended question is a style as put yourself in more of a equal or even a little bit lower of a position as you want the teens to teach you what it is rather than you know more than the teens and you're waiting for your teen to say the right answer. So that's a huge difference, okay? Teens are very used to parents just kind of come in and interrogate us like, what did you do? What's wrong with you? What's going on with your life? They don't like that. That usually makes them to be like, everything is fine, go away, get out of my room. That's how they would answer. But if you're kind of like, I really want to know more, like, can you tell me, can you help me understand what's going on? Like, I'm really curious. If you're coming as like, I'm very curious, it's like, please do tell me more because I want to know. It makes the teen feel like, oh my gosh, I know more than my parents. Let me tell you what I know. And that's when you slowly find out what's going on.
Okay. I have another question. The word suicide seems so harsh. Is there another word that I could use to talk about suicide with my kids?
So the word suicide is so harsh. Is there any way that I can reframe it to be as, okay. I want to tell you that, go like, because it's, I know that suicide, the word itself is very triggering. And this is why I gave a disclaimer that this is a tough subject. You can probably say ending your life. You can probably say being dead or something like that. But to be honest, in my clinical training, we are taught to go straight to the point. Because if you are saying, oh, have you thought about not being here? We don't know what you're talking about. Are you saying that we're not going to live in the city, or are you talking about not in the school district? What's going on? Also, you want to be very clear that we're talking about suicide. We're not talking about getting hit by a car. We're talking about you ending your own life. Have you ever thought about that? If so, please tell me more about it. The idea is that when you're beating around the bush, you're in a way not ready to talk about it. And if your child notices that you're not comfortable to talk about it, they're going to baby you. They're going to be like, oh, my parents can't handle that conversation. I need to pretend that I'm okay, because I don't want to make them worse. The last thing you want is to have your child to protect your emotional distress, because if they're already kind of struggling and realizing that their parents can't even handle that conversation, guess what they would do? They would not talk to you about it. And maybe that's when self-harm started to happen.
Great. I have another question. Is self-harm and suicide an addiction? As in, once it's identified or once the child starts, do they need to be treated over a lifetime, kind of like alcoholism?
I see. So on the podcast I talked about, the savvy psychologist, there is one specific episode that talks about self-harm. According to that podcast and according to the research that they found in there, is that people do eventually stop self-harming. So it could just be like, we call it as a phase. And when people get out of the self-harm trend, there are major three reasons. One, they're being more aware that what they're doing isn't going to help them. So the realization that self-harm doesn't work is a good kind of like a reverse moment for them to kind of like from doing to not doing. Two is that they finally have a better support system. So they've realized that people do care about them. That is also another factor that make them from self-harming to not self-harming. And then the last one is that they simply just grew out of it as they get older, they move out of the house, they got a job, they met someone who's meaningful, and they've realized that they don't have to self-harm to cope with that misery anymore. So those are the three predictors from self-harming to not self-harm. However, there could be a good amount of people that never get hit but with those positive factors and continue to struggle. With the suicide, I wouldn't say that it's an addiction. I would say that it's becoming an available option to them. It's like no one is chasing after being suicidal. It's just that they have their comfort zone is like as broad as death wouldn't be a bad idea. So it just makes them more comfortable to consider suicide whenever things get tough. So definitely I would say that, you know, you kind of like pass that hill. It could always be in the back of your head, but it doesn't need to be treated like a chronic addict. It's really more about finding the right treatment and really truly address the issue rather than beating around the bush.
And I have at least one more question. If my teen is depressed, how do I give consequences? Like if they do something wrong, or should I just avoid punishment altogether because I don't want to make it worse?
So the question is, if my teen do have suicide and self-harm behavior,
and like they get in trouble and I would normally give them a consequence, should I not give them a consequence because it'll make their suicidal ideation or make them actually like self-harm?
I see. Well, it really depends on what the consequence that you're referring to. If the consequence is yelling, probably not a good idea. If your consequence is to take away the phone or to stop you from going to school or things like that, I can see that this is not really hitting the spot. When we talk about consequence, we're talking about getting the right treatment. So the idea is that if my child had a suicide attempt, it might feel like a consequence that the person has to be in a very intensive treatment, and you have to frame it in a way as that's because we care, because it seems like this is beyond what we can help you with, and we just want you to get the help that you need. When it comes to consequences, it has to also be kind of like really hit the spot, and instead of just kind of like out of your own comfort as I give the consequence because I feel like they deserve it, rather than what is the real best outcome if I provide this to my teens.
I just want to get a little bit more specific, like maybe give you an example. So
Okay.
my teen has depression and they have a history of self-harming. And aside from that, their normal routine is that they're allowed 3 hours of gaming. And after the 3 hours, I ask for the game back and they refuse to give it to me. And normally their consequence would be I would take their game away from them for a week. Should I avoid doing that consequence because maybe they'll get so angry that they'll self-harm or want to kill themselves?
I see. Well, I think you should be consistent with the consequence pattern. If you change your consequences pattern, because it sounds like to me, in your situation, it's not really like a direct correlation to the self-harm. It's just really like, typically this is what I do.
Right.
Once your teens realize that you're babying around it and you are trying to not provoke or trying to not make things worse, it could be an enhancement factor. It's like, oh, I realized that if I self-harm, my parents would baby me, or my parents would dance around the subject, or my parents would give me more than what I wanted. Then we're talking about the influence, the learned behavior is like, I need to present to be certain ways in order to get what I want. If that's the case, like Demetra, you're saying, definitely stay consistent. In fact, consistency is called structure. Teens love structure, even though they hate it. Always stay consistent with what's been established. If it's been working, don't change that. If your child self-harm because they're upset with you about taking the game away, you can always refer back to like, hey, because this happened, we're going to have a conversation with a licensed professional to really talk about that situation. And if that means that you don't get to play video games in the afternoon because you have to be in treatment, that's just the way it is, because your self-harm is much more important than playing video games.
Great. I'm just checking real quick. I think that's all of our questions. I'm just checking all of our platforms. So I think that's all of our questions. So I would like to thank the ever knowledgeable and talented Sunny Wang
Thank you.
for all of the important information you dropped on us tonight. I am thankful to have a clinician on our team and in the community willing to take time out to be real and tell us the truth. If you are interested in contacting Sunny for any additional speaking engagements, you can email us at info@jacobsladdertherapies.com and we will pass on the information. If you missed any parts of this or want to recap, you can view it in the Jacob's Ladder Facebook or YouTube channel. And again, I will post the links in the comment section. If you feel you or your family member could benefit from therapeutic services, please contact us. We provide free assessments to help determine the right level of care for your family member or your child, even if it's not with us. And yes, Sunny is available for both in-person and video sessions for your teen or family. And I have already put the link to self-schedule an assessment in the comment section. You can view all of our clinicians on our website at www.jacobsladdertherapies.com. Thank you again, Sunny, and to all of our viewers, stay safe, be well, and have a good night.
Thank
Bye,
you.
everybody.
Bye-bye.